Hello everyone, my name is Gabrielle Mondragon and my classmates are Justina Nicola and Kenny Nguyen, and we have performance enhancing drugs.
Substance abuse is overindulging on an addictive drug like performance-enhancing drugs, and these are such as steroids, human growth hormone, and stimulants that are used to elevate performance in sports and can lead to addiction. Drug addiction is the state in which either discontinuing or continuing the use of drug creates an overwhelming desire and craving for more of the substance. The abuse and misuse of these drugs can lead to real problems in sport and exercise and can cause serious health issues and lead to death. It wasn't until the 20th century that these substances arrived at the athletic world, became common, and turned into a huge hindrance to fair competition.
So in this slide, we'll be talking about the reasons athletes and exercisers take and abuse drugs. For the first reason, for the physical, it's that it improves performance with expectations. So in this slide, we'll be talking about the reasons athletes and exercisers take and abuse drugs. For the first reason, for the physical, it's that it improves performance with expectations that they might increase their strength, endurance, alertness, and aggression, as well as decreasing the fatigue, reaction, and anxiety. And as a psychological reason is that drugs can be used as an escape from unpleasant emotions and dealing with competitiveness, as well as using the drugs to offset their stress that's caused by trying to balance their goals, schedules, and personal relationships. It also builds self-confidence, creates less tension upon the competition and the participants, as well as self-control. And the last reason is the social, which is pressure from peers and the need to be accepted in the group.
Major drug categories include performance enhancing drugs. These include anabolic steroids, beta blockers, and stimulants used by athletes to increase strength, calm nerves, or block pain. Another category is recreational drugs, also known as street drugs. These are substances people seek out and use for personal pleasure, whether it be for escaping pressures or fitting in with friends who use drugs as well. Some common recreational drugs are alcohol, cocaine, marijuana, and tobacco. Another category includes pain relievers. This affects people inside and outside of sports and are usually prescribed by doctors after surgery for a chronic condition. They are very addictive. Some medications include OxyContin and Vicodin. A study done with approximately 1,500 adolescent athletes found that males who participated in competitive sports across the 3-year study period had 2 times greater odds of being prescribed painkillers when compared to adolescent males who did not participate in competitive sports. Some common side effects of these drugs include mood swings, drowsiness, increased blood pressure, dizziness, and increased heart rate.
Substance use and abuse are detected by formal procedures like drug testing and informal procedures like observation and listening. Unfortunately, properly conducted drug testing is rarely used due to its high cost. Some of the symptoms for those who use drugs include, but are not limited to, changes in behavior, impaired judgment, and major changes in personality. Before any accusation, these sometimes are just the result of other emotional problems. One model proposed to help detect substance abuse is the sport deterrence model, which helps us understand the process individuals go through when deciding whether to use drugs. The drug in this model consists of 3 major components: the cost of a decision to use, the benefits associated with using, and specified situational factors that may in some way affect the cost-benefit analysis of using. The costs vary from social sanctions like criticism by others to negative health effects. The most powerful deterrent is self-imposed sanctions, especially when the action of taking drugs goes against the athlete's motor values. And the least effective deterrent is legal sanctions. Also, to reduce the inadvertent doping in sport, the British Association for Sport and Exercise Sciences has developed guidelines using the COMBI model of behavior change. Capability, opportunity, and motivation. Capability focuses on psychological and physical capacity to reduce inadvertent doping risk. Opportunity are factors lying outside of the individual that make performance of the behavior possible or prompted, and motivation is associated with brain processes that energize and direct behavior. The 3 most common causes of inadvertent doping are taking medication without knowing what it contains, contaminated dietary supplements, and contaminated food. The association statement provides information and guidelines to educate the athletes. Also, a formal drug education program has also proved to be effective. The NCAA Drug Education Committee originally developed a set of minimum guidelines for policy consideration by its member institution. This model provides drug education for athletes and athletic officials, treatment support, and training sessions for coaches.
NCAA's survey of athletes conducted from 2010 to 2011 found that more than 50% of athletes believe that mandatory drug testing has reduced NCAA athletes' use of drugs. Because substance abuse is a clinical matter, sport and fitness personnel are unlikely to be involved in drug treatment programs. However, they can provide resources to our athletes. One being providing supportive environments that address the reasons individuals take drugs. This will empower the athletes through increased self-confidence. Another is to educate participants about the effects of drug use. This includes giving credible negative and positive effects of various drugs. Expose athletes to the notion that using drugs amounts to cheating and unfair competition. This will enhance the athlete's morality, which is taken very seriously in sport. The athletes will be less likely to take part in usage of drugs. Be an example or role model for athletes. Coaches have a huge impact on their athletes, and actions speak louder than words. This means that coaches themselves should not be using drugs or influencing others. And lastly, teach coping skills. Coping strategies such as practicing positive self-talk and thought stopping will help an athlete to decrease anxiety and stress, which also stops the usage of drugs.
It was not for the athlete to decide alone that an anti-doping test shall be invalidated and the sample containers destroyed. As a consequence, Sun Yang committed an anti-doping rule violation by tampering with the doping control.
Sun's response was immediate, telling China's official news agency, "This is unfair. I firmly believe in my innocence. I will definitely appeal to let more people know the truth." The Chinese Swimming Association says it deeply regrets the ruling and fully supports Sun, although it had itself banned him for 3 months for doping in 2014.
Punishment for athletes who use performance-enhancing drugs is controversial in the sport and exercise world. Do you believe a lifetime ban is too harsh of a punishment, or should it be more drastic? And if it was up to Sun Yang to decide, do you think he would choose to allow doping in sport?